This conference will now be recorded.
Here we go. Good morning, everyone, and welcome to the November edition of the Hooved Animal Humane Society Saturday Seminar Series. Our topic this morning is caring for the senior horse, and we are very lucky to have Dr. Lisa Nesson of Iron Gate Equine Clinic in Madison, Wisconsin, here with us this morning. Dr. Nesson has been a lover of horses for nearly her entire life. Her great-grandfather raced standardbreds, and her love affair with American saddlebreds began in high school. Her first horse, Rebel, just passed away at the age of 34, so she is uniquely qualified to discuss senior horse care. A Wisconsin native, she earned her veterinary degree at the University of Wisconsin-Madison and then completed an internship at Auburn University, followed by a 2-year residency in large animal internal medicine at Cornell University. She has presented at Midwest Horse Fair, as well as the Wisconsin Veterinary Medical Association, the American Saddlebred Association of Wisconsin, and the Wisconsin Equine Practitioners Association, where she served as president. She is a veterinarian with Iron Gate Equine in Madison and provides vet care at horse shows throughout the state. We are so grateful she's taking the time to be with us this morning. Welcome, Dr. Nesson.
Thank you. Thank you for having me today. I really appreciate the opportunity to speak with you guys today. So I want to...
All right, I'm handing it over to you.
Okay. I want to start by thanking the Hooved Animal Humane Society for asking me to speak with you all this morning, and thank them for what they do for horses across the area. Just a little bit about the horses on the right-hand side of the screen. This was a client's mare that she rescued. I don't know if it came from a humane society, but I'm pretty sure it came from a rescue. That one morning they called pretty early and said they had 2 horses where they used to have 1. Anyway, this little filly showed up with a number of problems. And
Dr. Nesson, we aren't seeing your screen right now.
Oh, you're not? Okay.
No.
Let me see why that is. So, all right, we'll go back. Share, hang on. Share your screen. Window. Okay, something has happened. Let me go to share entire screen because it's taken away my option to share the window.
Okay. There we go.
Okay.
Screen.
Let me go. Can you see it now?
We can.
All right. We're back to seeing the care of the senior equine.
Yes,
we are. Can you see my first slide? Okay.
Yes, we can.
All right. So we'll go on then. So again, thank you for what you do for horses everywhere. So I'd just like to start with an overview of what to expect from today's lecture. We're going to talk a little bit about how old is considered a senior horse. That has changed over the years that I've been practicing. Then a little bit about preventative health care that's affected by age, such as vaccinations, deworming, dental care. Some on housing requirements for our geriatric horses, because some of the things that we can get away with in younger horses become a little problematic in these older horses. The nutritional changes and requirements that change over the lifetime of a horse. Some exercise and pain management concerns. And then we'll go through a list by body system of some common health issues that senior horses have that might be a little unique to them versus the younger horses. So what age is considered geriatric? When I first started practicing, Horses that were reaching the late teenage years were considered by many owners to be old horses. That has changed as horse populations have aged further. Horses are living longer. So now we consider old horses or geriatric horses to start at about 20 years of age, with very old horses living into their 30s and some even into their 40s. I do have one donkey in our practice that is, we're pretty sure is into his 50s now, which is a rarity. But about 20 to 30% of the population is greater than 20 years of age. And in human years, one horse year is approximately 3 human years. So a 20-year-old horse would be about 60, or a 30-year-old horse would be about 90 in people years. So why do we care about senior horses? So from my perspective, I have to care about them because they're living longer and the geriatric population is growing. So a large portion of our practice, which is our practice is primarily backyard horses, performance horses, and trail horses. We don't take care of a huge population of race horses, so we have horses that belong to owners for a long period of time. Many single owners for, they may own the same horse for 13 plus years. That population is growing, and those horses require care. They're living longer for a number of reasons. There's been several advances in veterinary care. Certainly nutritional options for geriatric horses have expanded greatly with all of the pelleted options and fiber, changes in what's available for fiber sources for horses that have declining dental care. And then also deworming care has changed over the years. Also, the bond with their owner has changed from that of a utilitarian animal in this country to more of a companion animal. And then many owners expect their horses to be performing well into their older years. And because of better advancements in veterinary care, these horses are able to perform at some level well into their older years. The horse on the left is a very good example of that. This one was born at our farm and showed with my husband through his show career. And after he finished showing, he was retired, which he hated retirement. We tried to turn him out, absolutely hated it. Brought him back in, and he started in our lesson program as an advanced lesson horse. And through the years, he progressed from an advanced lesson horse to an intermediate lesson horse, and then a beginner lesson horse. And, by the time he was into his late 20s, he was a lead line lesson horse. And at the time of his death at 30, everyone at the farm had either seen him showed him, or had taken lessons on him. So he had given us his entire life. God, I'm tearing up. And therefore deserved a good retirement. Anyway, some management plan basics. We're going to observe them on a regular basis so that we get to know their normals. You want to be able to observe your horse as frequently as possible, whether it lives at your house or at the boarding facility, so that you know what that horse looks like when it's normal. Body condition score, 5 is considered ideal on a scale of 0 to 9, with 9 being morbidly obese and 0 being a skeleton. 5 is considered ideal. A lot of our horses are in the 5 to 7 range, and that's great. Also want to know what their normal behavior and attitude is. When do they lay down throughout the day? How bright are they normally? How do they act when they're alone? How do they act when they're with other horses? Just so that you know what normal looks like for your horse. Do they have adequate shelter? So that might be a stall at night. Stalled as their primary source of shelter. Spending several hours a day in a stall is not necessarily the best option for older horses because as they develop stiff joints and muscles, that will stiffen up worse when they're confined. So I would prefer that they be kept either in a stall at night with turnout during the day so they have plenty of hours of turnout time, or have them in a paddock with a run-in shed for shelter so that they're turned out basically all the time and they can move at will. They may need to be blanketed in bad weather, just depending on their body condition, hair coat, and then the adequacy of their shelter. If they have a body condition score of 5 or better with a good hair coat and shelter that is adequate, they may not need a blanket at all. Or they may only need a blanket for those few days when it's tremendously cold, below 0 with a wind chill, or very wet and cold. They should have adequate, appropriate exercise to maintain their muscle tone and joint flexibility as much as possible, as long as that is provided on good footing. So either, non-slippery surfaces. So if you're maintaining your horse in a paddock, you want to make sure that the paddock is drained well so that it's not deep mud that would then freeze, or a skating rink that they can't walk on after a rain and then freeze. So you need to be aware of pecking order issues. So horses are herd animals, and they will develop a hierarchy within any group of horses, whether it's 3 horses or 10 horses. Somebody's going to be the boss and somebody's going to be the bottom. Geriatric horses will fall anywhere in that pecking order, just depending on their personality and how well they are doing physically. They may start out at the top of the pecking order, and then as physical conditions rear their ugly heads, they may work their way down the list. But if they're being fed in that group, you need to be aware that they will get less and less food if they are at the bottom of the pecking order. So if your horse is losing weight and it's living in a group, one of the first things that I ask owners is, where do they fall in the pecking order? Is there enough food out there? And do they have access to it, or are they getting chased off? Are the horses at the top of the pecking order getting fat and the ones at the bottom getting thin? Make sure you're feeding a high quality diet, so avoid dusty or moldy hay that they may not be eating at all. And then you might need to adjust their ration to maintain proper body conditions. So we should be able to feel their ribs, but not necessarily see them clearly. So just a hint of ribs. And when you feel them, you don't want to feel them like you're strumming an accordion, or you want to be able to feel that there's a layer of flesh between your fingers and the rib bone. They may need to be fed on more frequent intervals to avoid digestive upset. So if they're on a pelleted diet as their primary source of feed, if they're getting 15 pounds of senior a day, you can't feed that in one sitting. You'd have to divide that up into 2 or 3 feedings per day, possibly. And then they should always, and not just seniors, but all horses should have free choice access to accessible water that's not frozen. So we're going into the winter time. I think tonight it's going to be 22 degrees here. So tonight will be the first time that the water tanks will freeze. And you want to make sure that your water heaters are out and functional and not short circuiting. So make sure that water is liquid and that they're not getting shocks off of your tank. And then also check the footing around those tanks. Make sure that you didn't overflow the tank and now there's a sheet of ice leading up to the tank, or a frozen cobblestone maze of mud that a horse with arthritis is not going to want to walk across due to the pain. Groom them regularly just to check them over for any lumps or bumps that have shown up since you looked at them last, cuts, skin conditions. Senior horses are prone to dermatitis or skin infections, especially if they have Cushing's disease. So just look them over on a regular basis. Check for swollen legs, uh, edema on the underside of their belly, um, eye problems. It's more than a bonding um, time with your horse. It's also a general health check every time you're with them. Um, in senior horses, melanomas on gray horses are very common as they age. Squamous cell carcinomas on pink-skinned areas of your horse, around their eyes, nose, uh, on their sheath or penis, and on the lips of their vulva. And then lymphosarcoma, if they're developing lumps and bumps around their throat latch, that may be a concern as well. So some preventative health care tips. An annual physical exam is always recommended for all horses, but especially for these guys, to monitor them for developing conditions as they age, but also to monitor ongoing problems. So if they were retired from a show career or a performance career with some lameness issues, those aren't necessarily going to go away. They may still need some care through their geriatric years. And then we need to watch them for the development of other issues, whether it be organ dysfunction or failures, cardiac issues, or the development of Cushing's disease as they get older, and then certainly dental issues. So an annual to semi-annual oral exam with whatever appropriate dental care is indicated at each of those exams. We may not float them every time we look at them, but we certainly should be looking in that mouth with or without sedation, depending on the cooperative nature of your horse. If it's a horse that won't let us get a decent look without sedation, then we should be allowed to sedate them at least once a year so that we can get our hands and a good look in that mouth to check for loose teeth, because as horses age, teeth can loosen. And just by looking, you may not be able to tell that they're loose. You may have to get a hand on them to tell that. And a loose tooth can put them off their feed and cause some weight problems that become insidious. Appropriate deworming should be based on a fecal egg count. As when horses are younger or middle-aged, they may be low shedders. We use a fecal egg count to divide horses up into groups, whether they be low, moderate, or high shedders of small strongyle eggs. And that is a measure of their level of immunity against the parasites. And that as horses age, their immune system becomes less effective for a couple different reasons. So your horse may have been a low shedder or a moderate shedder when it was younger, but as it ages and they develop some decay or degeneration of their immune system, their egg count may go higher. So they may need to be dewormed, once or twice a year as a younger horse, but as they age, they may need to be dewormed 3 or 4 times a year. So continuing to monitor fecal egg counts is important. And then appropriate farrier care is not going to end just because they're geriatric, and it may become more intense if they develop laminitis due to Cushing's. Immunizations don't go away either, so vaccinations should continue either on an annual to semi-annual basis. This is dictated by their housing situation. If you have, a couple horses that live in your backyard and they don't travel anymore, and they're not exposed to any other horses, then just doing the core vaccines once a year is probably sufficient. But if you board your geriatric horse at a boarding facility that has multiple ages of horses that travel then you should include not only the core vaccines, but also the risk-based vaccines. And by core vaccines, I mean Eastern and Western encephalitis, West Nile, tetanus, and rabies. Those are all considered core and recommended for all horses, regardless of their housing situation. They're mosquito-borne diseases or diseases that are brought in by wildlife or from the soil, such as tetanus. And then the risk-based vaccines include infectious diseases that are carried by other horses, and they would need to be exposed to another horse in order to get them, such as influenza, rhino, strangles being the big three, but also Potomac horse fever is included on this list. It's not transmissible horse to horse, but there's certain parts of the country that just don't see it and other parts that do. So those vaccines are based on whether or not your horse is going to be exposed. But just because your horse has been vaccinated his whole life, they don't carry immunity lifelong. They still need to be vaccinated because as their immune system function declines, their response to those vaccines or some of those vaccines also declines. So they still need to be vaccinated. And then also consider blood work on a schedule that's recommended by your veterinarian to look for subclinical issues or to monitor conditions that have been diagnosed previously. So PPID or Cushing's screening or monitoring if they're on medication, chemistry panel to look for liver and kidney function, muscle function, and then a complete blood count to look for any evidence of infections if you're having weight problems or respiratory issues, as well as anemia. So their nutritional needs may change based on their age, but also on a lot on their dental situation. So initially, as they age, their diet should be similar to that of a mature horse, but they may, their digestive system becomes a little less effective or less efficient. So they'll need a slightly increased protein level. So they may have been on a 10 or 12% through their teenage years. They may need 14% as they get older. Their phosphorus needs are slightly increased. Calcium to phosphorus ratio is about 1.5 to 1. Vitamin C and B complex levels requirements go up a little bit, as well as an omega-3 fatty acid, which they can get from soy or flaxseed oils. But their health issues will certainly influence their diet recommendations and should be discussed on a regular basis with your veterinarian to make sure that your particular horse has the diet that they need. Should be highly palatable, easy to chew and swallow, especially if your horse has compromised teeth. Because what we don't want to see is a horse that looks like this at the beginning of the winter. I think this was November several years ago, and this was the first visit I had with this horse. So we were behind the 8 ball immediately. So diet considerations, as I alluded to, over the years, diets have really expanded. There are a number of senior diets or complete pelleted diets on the market, so that horses that can't chew hay have a number of choices out there to get the fiber they need. They have to contain enough high quality fiber to aid digestion. Horses cannot live on a concentrate diet alone. If they're eating a pelleted diet, it has to contain a fiber source in it that has been reduced to a pellet. It must be in a form that they can eat. So when they're younger, they may be able to eat long stem or chopped hay, but as their teeth decline, that may have to switch over to hay pellets or cubes that are either dry or soaked. If you're going to feed beet pulp, that's a fine fiber source, but make sure you soak it. It has the nasty habit of expanding when it gets wet, so if they take a big mouthful of it, and don't swallow it completely. As it gets soaked with saliva in their esophagus, they're probably going to choke on it. And then senior complete pelleted diets have really been a boon and have saved the lives of many horses and allowed horses with really limited dentition to live for a number of years past the lifespan of their teeth. So how much do you need to feed? If you do the math, it always seems to be more than what you're probably feeding now. So maintenance for a horse is about 1.5 to 2% of its body weight if their body weight currently is adequate. So if they're at a body condition score of 5 or 6, and you weight tape them, or you have the luxury of putting them on a scale so you know how much they weigh, then 1.5 to 2% of their body weight should maintain that body weight. So a 1,000-pound horse would need somewhere between 15 to 20 pounds of dry matter feed per day. And that would include their fiber, so all fiber sources, whether that's pasture, hay pellets, beet pulp, whatever, along with their concentrates. So everything that they're taking in during the day would need to be somewhere in the 15 to 20 pounds per day. But if your horse is underweight, then you want to feed at about 2.5% of the target weight, so the weight that you want them to be. So if you have a 850-pound horse, so say this horse here, weight taped about 850, but we think it should be about 1,000 pounds, then we're going to feed at 2.5% of 1,000 pounds because we are playing catch up. So about 25 pounds per day, which again, we can't feed that all in one feeding. We would need to do that in 2 to 3 feedings per day. So about 3 feedings of 8 pounds each. And again, that includes their fiber and concentrate diet. But if they're on senior, their fiber and concentrate diet is all the same diet because the senior would provide all of the fiber that they require. We'll get back to a little bit of nutrition down the road. So, as they age, horses change appearance. This is the same pony. So this is a pony that my husband bought when he was a 4-year-old. The pony, not my husband. And everyone showed him. He was an awesome road pony. And this upper picture was taken when he was at his peak. I think that was me showing him in a class of 25 ponies at the Illinois State Fair. It was an awesome class. He lived to be 34 and changed quite a bit over the years, but was just a really nice pony. We had to retire him because he started having grand mal seizures in his late teens that happened for a number of years, and then they stopped, which was kind of strange because I never figured out why he was having them, but they went away. Anyway, so over the years, they will gray out over their face and body. He developed spots all over his body, which was interesting because he was a Hackney pony that was a bay throughout his entire life until he got old. They'll lose muscling on their top line and elsewhere, might develop a sway back or a pot-bellied appearance. The bones around their eyes become more prominent. They might lose muscling over their cheeks, and their cheek bones become more prominent as their teeth decline. They'll have changes in their hair coat or shedding pattern, especially if they're developing Cushing's disease. There'll be loss of stamina as their muscle tone declines, and they'll have obvious dental changes as their teeth wear out. Some of these are normal aging issues, such as the dental changes. Others are developing medical conditions, such as the hair coat issues. Hair coat changes are almost entirely linked to Cushing's syndrome or PPID, which we will be talking about a little later on. So again, some of it is normal and some of it isn't. So some of it needs to be addressed with a diagnosis and treatment plan. Other things need to be managed. So common problem areas are that their digestive tract becomes less efficient, so we will need to adjust their nutritional profile and products that we make available to them. They're more susceptible to parasite issues as their immune system and immune defenses against parasites decline, so we may need to deworm them more frequently. Dental abnormalities become more prominent as they age and their cheek teeth wear out or they develop incisor issues. These three are the big three that contribute to weight issues in geriatric horses, not to mention whether or not they have access in the pecking order to feed or just access, is the feed being given to them in a form that they can eat. Bones and joints become less resilient, and some conditions that they have, such as Cushing's, make them more likely to have tendon issues due to tendon laxity that develops with that condition. Arthritis is more likely, just like you and I, as we age, there's wear and tear on your body, and chronic pain management comes into play. Respiratory concerns, the most common respiratory issue with older horses is COPD, or chronic obstructive pulmonary disease, or HAHS as it's better known by most horse owners. They're less capable of coping with environmental stresses such as wind, wet, cold, or extreme heat. So extremes in weather or quick changes like we're experiencing right now in this part of the country make it more difficult for them to handle. So need to be aware of that and adjust accordingly. And then they'll have hormonal changes that can affect body condition, hair coat growth, appetite, energy levels, and immune function that will slow healing from disease or injury as they develop PPID. And I keep bringing that up because by the time horses are in their 30s, about 30% of them have this condition. And that percentage may be higher if we're able to diagnose it at an earlier time frame. So some of the common conditions by body system that we're going to talk about are colic, choke, dental disease or alterations, pituitary pars intermedia dysfunction or Cushing's, lameness in general terms, recurrent airway obstruction, neoplasia or tumors, a little bit on heart disease, and ophthalmic issues. But one thing I want to mention is that old age is not a disease. It's cruel, but it's not a disease. And this is a photo of Rebel, so he makes it into every lecture I give. So anyway, so colic. Colic can occur at any age of a horse's time. In older horses, the most common medical colic that we see is related to dental changes or maybe lack of access to water, is a large colon impaction. It's the most common form of colic that we see in an older horse for a medical reason, or that can be treated medically. So if they're eating hay and they have poor teeth, they're not able to chew it effectively, so longer stem fiber is reaching their colon, which their colon, if you know anything about the digestive tract of a horse, their colon has very large sections as well as very narrow areas. And if there is long stem fiber, it has a hard time getting through the narrow sections. So they're more likely to develop a fiber mat, especially if they get a little dehydrated, that gets stuck when it gets to one of the narrow sections of their colon, such as the pelvic flexure. These frequently can be treated on the farm. We rarely have to refer them in for medical management at a referral hospital. Most of the time they resolve on the farm with oral fluids through a stomach tube, pain management, and some laxatives. Strangulating small intestinal obstructions. The most common one is lipomas in older horses. Lipomas are a fatty tumor that develops in the mesentery of the horse, and it will hang like a soap on a rope and wrap itself around segments of the small intestine and cause an acute colic situation. These are surgical lesions and will only resolve or frequently resolve only with surgical management. So whether or not your horse will resolve, will need medical or surgical management depends entirely on what the intestinal lesion is. Colic is just a clinical symptom of abdominal pain. It doesn't tell us what the lesion is that is causing the pain. That's why we need to see the horse, is to try and determine why it's colicking, and then determine whether or not it's going to be able to be treated on the farm, or if we're going to need to send it in for more intensive medical management, such as IV fluids, lidocaine drip, or if we're going to need to take it to surgery to get that resolved. So we get asked all the time whether or not my horse is too old to have surgery. Again, age is not a disease. So this decision is a very personal one for a lot of horse owners. It should be made based on humane, emotional, and economic considerations. Can you afford surgery? Is it what is best for your horse for humane reasons? What other medical conditions does your horse have that would influence the outcome of that surgery? One thing about old horses that make them have a lower prognosis from surgery is that they can be very stoic. And this stoic nature may delay treatment or referral because they're not exhibiting as much pain as a younger horse may exhibit. So they may not get noticed to be colicking, or their colic might be perceived as less severe because they're just not showing that much pain. So treatment might be delayed until they're sicker or their lesion has progressed to a point that surgical intervention isn't going to help that much. Older horses are more likely to need surgery due to the nature of their lesions. So I'd go back to the previous slide that said that 44% of their small intestinal lesions are strangulating lipomas. These almost always need surgery to resolve them. There was a study that was presented at the 2013 AAP meeting, which is the National Convention for the Equine Practitioners, that showed that senior horses that have a similar condition to a younger horse, so a strangulating lipoma in a geriatric horse compared to that in a younger horse, have the same complication rate. They also have a similar survival rate for similar lesions. So age alone should not decide whether or not you go to surgery. You should take all of the other factors into account, as well as your economic situation. Certainly, the time that you have with the horse after surgery is going to be shortened in a 25-year-old horse versus a 3-year-old, but that age alone should not make your decision for you. So if your veterinarian is standing there saying your horse is too old for surgery, I would question that. If your horse is pretty healthy and you want to take it to surgery, go for it. Choke or esophageal obstruction. What is it? It's an obstruction of their esophagus. So the esophagus is the tube that carries food from their mouth to their stomach. And it prevents the horse, when there's an obstruction in that tube, it will prevent them from swallowing any more food. The difference between choke in a horse versus a human is that horses can still breathe. In humans, when you hear that a person is choked, it usually means that their airway is obstructed, and that's a life or death situation within a matter of minutes. In a horse, it's a food obstruction in their esophagus, not their trachea, so they are able to breathe, and hours can go by with them obstructed without us losing them because of a breathing situation. We don't want hours to go by because there's other issues that can develop, but you can certainly wait for us to get there to treat them. It's commonly caused by pelleted feed or eating pelleted feed too fast or bolting feed. It can be caused by anything that they swallow, whether that's a chunk of carrot, piece of apple that they didn't chew, corn cob, beet pulp that was dry, a wad of grass. But most often it's a pelleted feed, and those are the easiest to resolve. Some of those other more solid structures are a little harder to get cleared up. So the clinical signs are pretty suggestive. One that I didn't list here is they may come in to eat and come in ravenous and then stop abruptly while they're eating and start demonstrating signs of pain. Nasal discharge with feed coming from their mouth and or nostrils. It may just look like saliva, but frequently it'll have feed material in it, whether that's grass or the pellets that they were eating. Coughing, they may look like they're trying to retch, where they tighten up their neck muscles and make some gurgling and grunting noises. There'll be some excessive drooling and salivation, disinterest in feed. The vast majority of them will not take another bite. There's a horse or two out there, I'm sure, that will try to continue eating, but most of them will stop abruptly and won't take another bite after they're choked. They can look pretty stressed. I think it's pretty painful and disturbing for them, so they may break out in a sweat. They might throw themselves to the ground a few times, roll, demonstrate some colic symptoms. But the way to differentiate it from colic is the stuff coming out of their nose, and especially if they were eating moments before and then abruptly stopped and started colicking, that's a choke until proven otherwise. And then they also may demonstrate the phlegm response, such as this pony at the bottom is, where they are lifting their lip and stretching out their neck and kind of shaking their head side to side to try and relieve that. So what should you do? Certainly you want to take the feed away from them so that if they are one that wants to keep packing it in, they don't have that opportunity. Call your veterinarian and then wait. Some horses may resolve the situation on their own as they salivate more. That may break that obstruction down and they may be able to swallow it. You can also take your hand and run it down the, whoops, let me go back and see if I can come up with a pointer. Here we go. You can run your hand down the left side of their neck from their throat latch to their thoracic inlet. The esophagus runs down the left side. I know this is the right side of this horse's neck, but if you run your hand down the jugular groove, starting at the throat latch and going towards their thoracic inlet, you may be able to feel the obstruction and kind of massage it and then work it out for them while you're waiting for us to arrive. Another trick of the trade that might raise some eyebrows, but it works in some horses, is if you just squirt a little bit of water in their ears, which irritates the heck out of them. They'll shake their head pretty hard, and that may shake it loose as well. So frequently, as I said, they'll resolve these. What they look like when they resolve is that this stuff stops pouring out of their nose. They stop the retching, they start mouthing and swallowing. You can see them swallowing. And then I frequently will say, if the owner calls and says, I think they might be clear, I'll say, well, just take them outside and see if they're interested in grazing. And if they go right back to grazing, or they take a big long drink of water and they swallow several times and they just keep on chewing and eating and chewing and eating, then we're in the clear. If they resolve within, a few minutes to a couple hours after it started, you can maybe, call and say you don't need to come, or, still have us come and look them over. The most common complication to choke is aspiration pneumonia, because they inhale this stuff and get it down into their lungs. That can cause pneumonia, and that needs to be treated pretty aggressively with some antibiotics and anti-inflammatories, because they can get pretty sick. And if we lose a horse that has choked, it's frequently not from the choke itself, but it's from the inhaled, the aspiration pneumonia is why we lose them. Let me get out of this pointer option here. All right, so as I mentioned, colic and choke can be related to dental wear and tear. So their horse's cheek teeth, so there's 6 premolars and molars in each arcade, right and left, upper and lower arcades, continually erupt throughout their life until they're somewhere in their 20s, late teens, early 20s. And then the crown on those teeth basically wear out, and they run out of reserve crown, and then that tooth is exhausted. And it may sit there through the rest of their days, or it may fall out. As those teeth stop erupting, they may develop what we call a wave or step or smooth mouth formation. And those teeth just basically are not useful any longer to chew and grind forage. They're also predisposed to periodontal disease because as the crowns wear out, they develop spaces in between those molars where food can get packed, and then that causes periodontal disease and loosening of the teeth, which results in tooth loss. And then these dental issues will predispose them to other problems that we have already discussed. So large colon impactions, weight loss, and choke. So I recommend that dental care should begin early in life, or as soon as I know we're talking to a Humane Society group. So as soon as you get your horse, have us take a look in the mouth and take care of whatever issues we can at the time of acquisition, so that we can prevent any issues, because some of these wave and step mouth situations can be prevented if we're allowed to take care of that mouth from an early age. If we're seeing the horse for the first time when they're in their 20s and they've already got a lot of changes to their mouth, we're going to be less effective at having an impact in that mouth than we would be if we were able to look at them from 3 or 4 years of age on. So this is our horse from one of our first.
Real quick, if we could pop back to the choke slide, we did have a question come up in the chat regarding which direction would you want to work the obstruction? Are you looking to work that down towards the stomach area?
Yes.
Okay.
So again, you want to start with your hands at the throat latch. Can you see my pointer?
Absolutely.
Yep. So you want to start at the throat latch and, kind of firmly grasp that jugular groove on either side of their neck. Their esophagus runs down the left side of their neck, but you can feel it on both sides. And you want to start at their throat latch. So let's see here. So this is their throat latch. Start here and run your hand down towards their chest. And just let go here and then grab up here again. massage where you feel the obstruction, and then run it back down that way. Let go, grab it up here, and do that again. And just keep doing that while you're waiting for us.
Wonderful. Thank you so much.
That will frequently loosen it up. They can get obstructions anywhere along their esophagus. So some of them are right behind their pharynx, which is up here. Midpoint, a lot of them are right at their throat latch, or I'm sorry, right at their thoracic inlet where their esophagus turns and goes through their chest. Massaging their esophagus here, if that's where the obstruction is, will have an impact. If the obstruction is in their chest, obviously doing this isn't going to do a thing, and getting them to shake their head isn't going to help, but it'll give you something to do. And at that point, while you're waiting for us, you don't know where that obstruction is, so it can't hurt. You're not going to be doing any harm. We will find out where the obstruction is, because once we arrive, we're going to do a physical exam, listen to their chest. We're going to sedate them, give them some pain medication, and then we're going to pass a stomach tube down their nostril to the level of that obstruction. So our stomach tube will go through their nose into their esophagus and get as far as wherever that obstruction is. And then with their head hanging from the sedation, we'll start pumping water in through our stomach tube and just gently lavaging or flushing that out. So at that point, it'll be coming out their nose. We'll get a lot more of this with food material coming out of their nose and mouth, and there'll be some coughing, and it gets pretty messy. But that's the best way of breaking that down. And then eventually, after it's been dissolved or broken down, we'll be able to pass our stomach tube all the way to their stomach. And we know that we've got it cleared when we either get some stomach gas or we've passed our entire tube and we're no longer getting this out their nose.
Wonderful. Thank you so much. And everyone, please feel free, if we're on a particular topic, to ask a question kind of at the end of that slide, or we can ask at the end, whichever you prefer.
Yep.
Thank you.
You're welcome. All right, so this horse has what we call a hook. This is a pretty prominent hook. I don't have a picture of the back of this horse's mouth, but we call this tooth the 06. This is the 106, is how veterinarians talk to each other about this. But in all likelihood, there's an equally large, what we would call a ramp. So we call them hooks if they're coming down from the top of the mouth, and ramps if they're going up from the bottom. So there's probably a ramp on the back of the last lower cheek teeth as well. And this horse may have an overbite that would bring his upper jaw in front of his lower jaw that would allow this kind of a hook to develop. The rest of his teeth that I can see in this picture look like they just have some sharp points. So when I would be floating this horse, I would take probably most of this hook off, depending on what I start to see as I'm floating. So they have vital tissue or a pulp chamber in all of their teeth. So their teeth are alive. And if we're floating along and we start to see a change to the top of that tooth, we may have to stop and come back in 3 months to take that tooth down some more. So there is a limit to how much tooth we can take, which again brings up the point. If we're seeing this horse on a regular basis, we can keep track of this in a horse that has an overbite or an underbite, so that we don't have to take this much tooth off in any one setting. This horse demonstrates a wave formation where we have a couple really long overgrown teeth, one tooth that's just about exhausted and has some gingival or periodontal disease around it, and then a couple long teeth again, and then some cheek ulcers as well. The opposite arcade is probably a mirror opposite image of this, where this tooth that opposes this is probably worn off to the gum line with maybe some sores around it based on how long this tooth is. And the tooth that opposes this one is overly long. So in a younger horse, we can see this start to develop and adjust these teeth so that they will not erupt in this pattern. But in an old horse, when they have stopped erupting, one thing that we have to keep in mind is that this is what they have to chew with. And if we correct this completely, we've taken teeth, like if I shorten this tooth, it's not going to erupt to meet the opposite tooth because this tooth is exhausted. So I have corrected the wave, but I've also taken away his ability to grind food. So I can't correct this completely. I can take away these sharp edges, and I can, maybe pull this tooth because it's probably loose anyway, but I can't correct this completely without making this horse have nothing to chew with. This horse has an incisor issue that I think we're going to get to on the next slide or two. So a complete oral exam should be performed either annually or semi-annually. And again, that doesn't mean we're going to float them every time. It just means we're going to take a look and see if anything has changed since our previous exam, or if there's something that we're watching. Is it time to pull a tooth that was maybe a little bit loose the last time, but now is a lot more loose, or has developed a looseness, or we've got one that's cracked now. We may need radiographs to assess root health or to determine how many pieces there are, if there's a tooth that's fractured, or if it has a fractured crown, is the root involved, and extractions are common. There's a lot of extractions that can happen right at the farm because they're so loose they fall out in our hands, but some have to be sent in if they're too far back in the mouth, or they break off below the gum line and we can't get that root out. So that skinny horse that I keep showing you a picture of had this incisor issue. These are not his incisors. So this is a mouthful all by itself: equine odontoclastic tooth resorption and hypercementosis. It's alphabet soup, EOTRH. It affects the incisors of older horses. We don't see this in horses under the age of 10, typically. The clinical signs are weight loss, excessive salivation or drooling, mouthing the water pail. So they may sit with their mouth in a cold water bucket. They may hold their lips open or grimace. I call it a grimace. Some owners say their horse is smiling, but I think they're grimacing because I think it's painful. They may start avoiding hard treats or biting apples or carrots that are hard. They may go from liking Granny Smith apples and biting those off of a whole apple to avoiding those and just wanting to eat the quartered apples, or a Red Delicious that's past its prime. So this is what a normal mouth should look like. So they have 6 incisors on the upper and lower arcades. They should all be right next to each other with no spaces in between them. They should all be about the same length. And the gingiva above and below should be nice and pink and smooth without any lumps or bumps or speckles or pimples of draining pus. And then the gingival papilla that comes down in between them should come down to within, a short distance of the top of the crown, and it should come to a nice point. There should be no blood or sores of any kind, and there should be no root exposed. And these should all be nice and tight. There shouldn't be any loose teeth here. This is a normal mouth. This is what that mare's mouth looked like when we opened it. So she's got some fractured tooth. This tooth is fractured. You can see she only has 5 upper incisors. This one is fractured off. I believe there was a root fragment left in place. This one is fractured as well. Her gums are pretty irritated and they have lumps in them. So there's some bony lumps, or there's lumps underneath. You can see that those papilla, or the gingiva that should be coming down to nice points, are basically gone. And there's definitely spaces in between her incisors. Her lowers, I believe she only had, 1, 2, 3, 4, 5. This one is fractured, and the corner one is missing, I believe, over here. I think anyone could look at this mouth and say that is not a comfortable mouth. Same thing could be said here. So this horse, when we lifted his lips, had a bulging, this whole area bulged. This is the entire root of this incisor. Same here. If we pressed here, that bulged. So this whole tooth was movable. This is a fragment of the next tooth next to it. And then we're also missing some lower incisors. And this one is fractured off. So if we take x-rays of these teeth, this is not those same teeth, but this is a normal set of incisors. They should have nice long tapered roots that come to a point with a nice defined periodontal ligament, which is this black line surrounding them. And you should be able to make out all 6 roots pretty clearly. It does take 3 x-rays to get all of their incisor roots clearly, but this is the first image you would take, and this looks pretty normal. These are upper and lower incisors of the same horse, and these would be somewhat similar to the second horse we talked about on the previous slide, where their gums are bulging. So this is the hypercementosis version of this condition, where instead of having a nice tapered root like this, they develop a ball of cementum, which is one of the compounds that form teeth. They develop a ball of cementum on the bottom of the root that then expands the socket that the tooth sits in. And you can imagine that as that is developing, it's putting pressure on the bone and expanding that socket, and it's putting pressure on the tooth next to it. And you would imagine that their jaw would ache. Over time, the tooth gets loose and will need to be pulled. So there's no treatment for this condition to stop this from happening or to reverse it. The only treatment we have currently is to monitor and then pull these teeth as they become problematic or painful or loose. So this is a little pony that we found it in as well. This is a diagnosis that we can reach based on clinical signs just by looking at their gums and then taking some x-rays and interpreting those radiographs. So this pony had both versions. He had the hypercementosis version with a bulbous root, and then he had the degenerative tooth resorption as well, where the roots, you can see these roots on this tooth and this tooth, both look like they have moth-eaten, somebody's been chewing on them, or a Swiss cheese consistency to that root. That's not a healthy tooth. And, these are the only 2 that look remotely healthy in this lower jaw. We would not leave those. We would probably pull all of these incisors. So horses can live without all of their incisors. We can pull all of them and they can still eat and graze effectively. The only thing that they might do is walk. If they're relaxed, they'll stand with their tongue hanging out, but they will pull their tongue back in when they're excited or paying attention. But other than that, there's really no reason to keep these incisors. They don't need them for chewing. And frequently, these horses will gain a significant amount of weight between when you pull these teeth and when they had them. The first horse that I sent in to have incisors removed had this condition, and it took me a couple years to convince the owner that we needed to do something about it. And by the time I got her convinced that we needed to do something, we needed to remove all of them. But we staged it. I sent him in to have the uppers removed initially. It wasn't this pony; it was a different horse. But between the time that we pulled the upper incisors and sent him in to have the lower incisors removed, he gained 100 pounds in a month, just by having those teeth removed and not really changing his diet in any other way. So they really do have an impact on their ability to eat when they're there and causing pain. The risk factors for developing this are chronic systemic inflammation is probably the biggest one. Any of these conditions will cause that, along with obesity. So Cushing's disease, equine metabolic syndrome, which is related to chronic obesity, and laminitis. But body conditions that cause chronic systemic inflammation is a big risk factor for developing. Excessive dentistry or trauma, cribbing horses that crib a lot are predisposed. We've gotten away as a profession from doing very much to their incisors with dentistry. So that portion of this risk factor should be lessened. There are some horses with overbites and underbites that we still need to deal with their incisors, but as a whole, we've learned enough that we're kind of moving on from doing a lot to their incisors. Periodontal disease, or lack of salivary bathing, which has to do with low mastication feeds. So if they are fed a high concentrate diet and they don't have access to long stem fibers such as grazing or long stem hay or pasture, they will produce less saliva and have less salivary bathing, because that bathing kind of washes their teeth and helps prevent this condition from happening. Head position when eating plays a role as well. So if they're eating out of hay feeders or hay racks or an elevated hay net, they'll have less salivary bathing. They produce less saliva. There was some work done to look at horses eating out of hay nets that were at neck level, with their neck horizontal to the ground. And this was more to do with gastric ulcers. And they discovered that if they were eating with their head parallel or at the level of their withers, where a lot of people hang their hay nets, they produce 75% less saliva than if they ate off the ground, which is where they're designed to eat. And therefore they had a higher incidence of stomach ulcers because they didn't have that much bicarb coming from their saliva. So another reason to feed your horse off the ground. All right, so we'll shift gears and talk a bit about equine Cushing's syndrome, or pituitary pars intermedia dysfunction. So this condition is very common in older horses. When I first started practicing in '94, these are the types of horses that we looked for it in. But as the testing has become more sophisticated, we are able to diagnose it earlier and earlier because this is a progressive condition, and we are able to find it in horses that look like this. So this mare and this horse both have it. She just has it at a much earlier stage that obviously was not affecting her reproductive status at that time. since then, she's had 3 more foals, but has needed a little bit more help with each pregnancy because of her Cushing's situation. Anyway, the average age is 20. Range is from 7 to, it's been reported in a 7-year-old. That's pretty uncommon. Up to 42, that was the limit of the study. Horses 30% over the age of 30 will have it. So I'm guessing as horses age, live longer, like my 50-year-old donkey most likely has it. We have not tested him because he's 50 years old and he has enough other problems. We didn't figure we needed to give him that one as well. It has a high incidence in aged horses. So the longer they live, the more likely they are to have it. The most common thing that we see are hair coat abnormalities, or failure to shed, or failure to shed in a normal fashion. And that is a pretty wide range. So they may just shed later, but shed completely, and then grow their winter coat back in earlier. Or they may hang on to guard hairs longer, or shed this hair coat, but in a very patchy fashion, and then grow it back in July. Excessive drinking, urination, and sweating is common. Laminitis and founder is the most common reason that we euthanize these horses or lose them because they founder and we can't control their laminitis. So if you have an older horse that has developed sore feet or laminitis for no other reason, the first thing we're going to test for is Cushing's disease. Other clinical symptoms are delayed wound healing due to elevated cortisol levels circulating in their body, chronic infections and parasite issues due to decreased immune function because of those cortisol levels. They may be under or overweight and have difficulty gaining or losing weight, blindness or seizures. So I should backtrack a little bit. This condition is due to a tumor that grows in the anterior portion of their pituitary gland, or the front portion of their pituitary gland. And their pituitary gland sits at the base of their brain, which is right about here. And that gland is in a little bony cup, shall we say. So there's really no room for a tumor to grow there. So when it does, it puts pressure. So it can cause some, as it gets larger, it can cause some seizures or blindness if it gets large enough. In mares, it may cause what we call inappropriate lactation. So they may develop milk in their udder, even though they have not had a foal recently. Insulin resistance or diabetes can develop. Behavioral changes, mostly they become pretty mellow, and it's oftentimes that's interpreted as just, they're getting old, and then they can have some reproductive problems. So the pituitary gland is a master hormone gland, and it produces compounds that tell all the rest of the hormone glands in their body basically what to do, how much hormone to produce and what hormones to produce. And this tumor causes those signals to kind of go haywire. So it affects the entire body in that way. It also affects their immune responses to vaccinations. So there was a study done and reported on back in 2014 that wanted to look at whether or not routine vaccines were affected by Cushing's. And so what they looked at were the immune responses to 3 vaccinations, which were influenza, rhino, and West Nile virus. I'm not sure why they picked these 3 and not tetanus or rabies or Eastern and Western, but these are the 3 that were included in the study. So they looked at these in age-matched horses with and without PPID and discovered that there was no difference in the response to flu, but there was a significantly lower response to Rhino and West Nile. So what that tells me is, one, you can't predict which vaccines they're going to respond to, and two, that this condition will lower their response to at least some vaccines. So we can't make the blanket statement that horses that are old and have been vaccinated their whole life have sufficient immunity and therefore don't need to be vaccinated. They do continue to need to be vaccinated because not vaccinating them will most likely make them susceptible to illnesses that they could be vaccinated for. So how do we make a diagnosis for this? We do blood tests or look for clinical symptoms. So how we diagnose it will depend on what stage of the disease they are at when we're asked to look at them, whether they're early or advanced. This is a progressive condition, so it starts with a few cells growing in that pituitary gland, and it has a subclinical or a portion of time when we can't diagnose it because it's not producing clinical symptoms that are recognizable. But as time goes by and the tumor gets larger, those clinical symptoms will become more evident. So there also are time of year considerations when we're testing them. So there's seasonal variations that affect the interpretation of the results and therefore the timing of the testing. We've gotten to the point where we have normals year round for the tests that we have available. Imaging, with the advent of CT machines that we can put a horse's head into, a standing horse's head into, we can now image it, but that's still not the standard of practice for diagnosing. Because just because they have the tumor, it doesn't necessarily mean they have clinical symptoms that are clinically relevant at the time. So imaging is still not the standard. Blood tests are the standard. So if they have advanced disease, like this horse, then we can diagnose it based on clinical symptoms alone or in combination with testing. So on this horse, I would probably, say this horse has Cushing's until proven otherwise, just because there's not really another explanation for this kind of a hair coat, unless this is a curly horse, a Bashkir curly. And then if the owner wanted to run some blood work or we wanted a blood sample so that we'd have a number that we could compare to and look at after we started treatment, I would probably just run a baseline ACTH level on this horse. So one blood sample to get an ACTH level. So that would be a resting ACTH level. This can be run year round. There are seasonal normals that we know about. So their level will normally go higher in the fall. So in the spring, we'd expect one level to be normal, and in the fall, we expect another level to be normal. If we had, this horse, we diagnosed off of a TRH stim test because her symptoms were more mild. So what that is we would give them, it's a more sensitive test that's available to determine earlier horses in the course of the disease. So if we're looking for an early diagnosis or a horse that has fewer symptoms, this is the test we would reach for. It's more sensitive. There's no fasting required, and it's can be done on one visit to the farm. We would pull a blood sample and then give 1 cc to a horse, a 1,000-pound horse. We'd give 1 cc of TRH, which is thyrotropin releasing hormone, give that IV, and wait 10 minutes and pull a second sample and then run ACTH levels on both of those. And in a normal horse, those levels should not change all that much. And on a horse with Cushing's, the second sample, the ACTH level would be elevated. We have to interpret those results with respect to time of year because, again, in the fall, the ACTH levels typically are higher. Ideally, we don't run this in the fall months, mid-July through mid-November. But if you are in a situation where you want to test in that time frame, we just have a higher number. So at that time of the year, that ACTH level in the second sample would have to be over 500 to support a diagnosis. There's really no side effect to this TRH, so there's no downside to using this. And what I've noticed, we're using this test more and more and this test less and less because as we run more of these, I've noticed that frequently a horse that ends up positive on this test will have a normal pre-ACTH. So if we had only run one sample or a resting ACTH, it would have been normal, and they have an abnormal 10-minute post sample. So based on that, in our practice, we are running these almost exclusively so that we pick up more and more cases. We can also run, if they're laminitic or overweight, we frequently are running insulin and glucose levels as well to test for insulin resistance. So there's another condition called equine metabolic syndrome that we need to differentiate from pituitary pars intermedia disorder. Those are two separate conditions. Equine metabolic syndrome may lead to PPID, and horses with PPID may be insulin resistant, but they can also have metabolic syndrome without having PPID. So we need to differentiate those, and this is one of the tests that we use to do that. So if we test them for Cushing's and they don't come back positive there, but the horse has laminitis, then we would test them for their glucose and insulin level. The most accurate way of testing that is an oral sugar test, where the owner would give a set amount of corn syrup, and then we would come out 60 to 90 minutes later and pull 2 blood samples for a glucose and insulin level. The goals of treatment for this condition are to control the symptoms, control the output of the hormones caused by the tumor, and then avoid laminitis. So either avoid it altogether if we're diagnosing it before it has occurred in a particular animal, or like in this pony has already foundered once. We'd like to avoid further episodes or make those episodes less dramatic going forward. So treatment options are management changes, but medication-wise, the go-to drug currently is pergolide. The FDA-approved product is Presend. If any of you are still using compounded pergolide, I would caution you and advise you to switch to Presend. I do not have a financial interest in this company, but the FDA-approved product is packaged in such a way that it remains active in the pills. The compounded product is not regulated in any way, and therefore we have no way of knowing how much active drug is present in the compound that you're giving. And those have been shown to, there's several compounded products out there that have inactive drug in them, so you have no way of knowing how much drug your horse is actually getting. And if your horse is not responding well or appears to be progressing beyond what your treatment is controlling, it may not be because their condition is worsening. It may be because they're not getting the drug. So if you're using a compounded product, I would switch to Presend so that you know that they're getting active drug. Because when this product came out and we switched all of our clients' horses to it, we had an overall improvement in all of the horses' conditions. So that told me that they were not getting the drug that we thought they were getting. So the dosage is 1 milligram per day per 1,000-pound horse once they're on the full dose. We want to start slowly to avoid loss of appetite. That's the most common side effect to this drug, is that if you go on it abruptly, they will frequently, about 1 in 3 horses will go off feed, and it takes them a while to come back onto their feed. So we start at a quarter to a half a tablet every other day, do that for 3 or 4 days, or 3 or 4 doses, and then we'll switch to a half a tab once a day, working up to 1 tab once a day. Cyproheptadine was around before Pergolide. Now it's just about as expensive as Pergolide, and we pretty much just use cyproheptadine in conjunction with Pergolide when we are losing control of them on Pergolide alone. And then there's a newer drug that I have a hard time pronouncing. I think it's cabergoline. Anyway, this drug is in the same family of drugs as Pergolide. It's only available as an injectable that would be given every 10 days and is reserved for horses that no longer are responding to Pergolide. And what I'm alluding to there is that because this is a progressive condition, it's conceivable that over time, as your horse ages and that tumor continues to grow, that we're going to lose control of it on 1 milligram a day. So over time, we may need to increase this dose, but at some point, we're going to get to a dose, which is usually about 3 milligrams a day, where the horse is going to stop eating. So then we have to add in other drugs or switch drugs to try and keep them responding to it. So once we start Pergolide, we usually keep them on it. A lot of owners will notice a change in their horse's attitude within 30 to 60 days. They just act younger. And then we'll retest them with the test that we diagnosed them with at 30 to 60 days and adjust their dose if needed. So what we're looking for is a significant drop towards normal in their ACTH level. They may not go back to normal, but what we'd like to see is a significant drop towards normal. And then we may need to adjust their dosage throughout the year. A lot of horses will have a difficult time in the fall when that ACTH level rises. So we may increase their dose in the fall and then drop it back down again in the spring. It just depends on the horse. The long-term response to in horses with PPID to Pergolide treatment has been good. Results in clinical improvement in the vast majority of horses. Normalization in test results in greater than 60% of cases. Again, that depends on how advanced the case is. The more advanced they are, the less likely they are to go back to normal, despite the dosage. But what we're looking for is not necessarily a normal number, just a significant drop, and then also clinical improvement. And there's been a high owner satisfaction with this drug. But again, the biggest complaint we get is that the horse stops eating, or they get tricky as far as eating it. So it's a small tablet. It can be hidden in a treat, like a piece of apple, hollowed out carrot. There's pill pockets that are available for horses, or sticky treats you can attach it to. I don't recommend just throwing it in their feed because it's an expensive tablet. And if you throw it in your feed, you don't know if they actually ate it or if it landed on the ground. I'd rather you stuck it in a chunk of apple or some other treat and watch them eat it. You can dissolve it in water, but I worry that more of it stays in the syringe than ends up in the horse. Aside from the medication, you also need to feed a low-starch diet. You might need to soak their hay to remove some of the sugars. If your hay has a higher starch content, we're looking for a starch content of less than 10% or 10% or less, but the lower the better. Limit concentrations and grass pasture. Manage their laminitis, at whatever level it is, or avoid it altogether if we diagnosed them before it happens. You might need to body clip them. So the pergolide should help with the shedding situation in their hair coat. It might not cure it completely, but it should help. And then provide excellent preventative health care. So monitor their deworming protocol based on fecal egg counts. Continue with your vaccination protocol based on your housing situation, whether you're in a boarding facility or living alone at home with them. And then farrier care based on, do they still have normal feet or do they have laminitic feet? So let me just. All right, so laminitis.
Dr. Yeskin, real quick before we jump to laminitis, and let me know if you are addressing this later in your presentation.
Yep.
But fecal water syndrome in senior horses.
Yes, I actually didn't include that in here. And not on purpose. I kind of forgot about it. But
no, that's fine. We can hit it at the end. We just wanted to check with you quickly.
Okay. Yeah, we can talk about it at the end, hopefully. Yes, we will. Okay. So laminitis. Always look for a primary cause. In an aged horse, that's probably going to be laminitis or going to be Cushing's syndrome, or we're at least going to test them for that. And if it's not Cushing's, and we've had no other inciting cause. So inciting causes for laminitis are grain overload. So your horse got out, broke into the feed room and ate a half a bin of your concentrate feed, and then has sore feet the next day. That's probably not Cushing's, especially if it's a younger horse, but it's because they ate too much. If they had a colic episode or they had an injury on one leg and now they're foundered on the other leg, we may not be testing them for Cushing's. But if your horse came in, had no other inciting cause and they're foundered or have laminitis, then we're going to test them for Cushing's, or at least we should be testing them for Cushing's. If they come back negative for Cushing's, but we're still suspicious, we may start treating them for it, or we may test them for metabolic syndrome just based on their body condition. It's associated with reduced hoof growth or quality, improper nutrition. So if you have a horse that has a body condition score of 7, 8, or 9, so they're pretty obese, that's, we're overfeeding that horse, putting too much strain on their feet, and that could cause laminitis with or without any other inciting causes. They may have systemic disease that's causing it, or just poor hoof care, overgrown feet that are predisposed to it as well. Laminitis management is focused primarily on diagnosing and treating their primary cause, and then pain management. By the time they're foundered and showing symptoms, a lot of the things that we can do to prevent it have gone, we're past that phase, unfortunately, and we're into the supportive care phase and trying to slow it down because a lot of the damage is done by then. So pain management falls onto nonsteroidals such as bute. Bute is a go-to for a lot of these horses. Equiox is come onto the market, obviously, in the last several years. It tends to be less effective for the level of pain that most of these horses are feeling. As we get them through the initial phase, we might be able to get them to Equiox and be comfortable, but usually in the initial phases, we're needing some bute. And then Banamine may be utilized as well, depending on what's causing their laminitis. If they're still pretty sick, we may be using Banamine to address the endotoxic side of things, as well as their pain. Equiox is thought to be less insulting to their GI tract and kidneys, but again, Bute seems to be more effective at controlling the pain that comes from their feet. There's also cushioning or supporting their feet. This can oftentimes be done with either shoes or boots. There's various different kinds of boots on the market that are really quite good at providing the cushioning and support that these horses need. The one thing I like about the boots is that we can change them pretty easily without having anything attached to their foot. There's also several things that your farrier can do as far as trimming. In the acute phase, we may not want to nail anything to these feet because of the concussion, but we can certainly do some trimming if it's required to get them to a more comfortable point. Radiographs are really important to help guide your farrier to know where that coffin bone is, and we'll have a slide here next with some radiographs so we can talk about that. If your horse is overweight, we need to adjust their diet immediately to try and get them to lose some weight, and also to lessen the starch insult that might be driving this laminitis episode. So low starch, pull the concentrates out of their diet altogether, limit their time or eliminate their time on pasture, put on a grazing muzzle, and put them in a dry lot. Some of them, if they're really bad, will be on stall confinement to try and prevent them from moving around a lot, and if their hoof capsule is unstable. So radiographs help us to determine, where the coffin bone is in relation to where it should be. So on the left, this is a radiograph, a side view of a horse's foot. So we have the hoof capsule out here on the lighter gray, the whiter area. This is the coffin bone, navicular bone, short pastern bone, long pastern bone, and fetlock. Fetlock joint, pastern joint, coffin joint. The bright white line is a barium that we painted on the front of the hoof wall so that we know where the coronet band is. So this starts at the hairline and ends at the end of the hoof wall. And then there's a dot of barium as well on the bottom of the foot, right in front of the point of the frog. So the purpose for this dot is it gives your farrier a marker so they can see where the point of the frog is, and now they can see where the point of the frog is in relation to where the point of the coffin bone is. Because without this dot, they can't tell where the frog ends on the bottom of this foot. So it gives your farrier a marker. With this radiograph, we can tell that we can take a measurement from the bottom of their coffin bone to the bottom of their sole, so we know how thick their sole is. We'd like that to be somewhere in the 15 to 20 millimeter range. This horse has far less sole than that. He probably has about 8 millimeters of sole depth, so that's a thin sole. And then we can also look at whether or not the coffin bone is in a normal position. So the front of the coffin bone should be parallel to this front of the hoof wall, and you can see that it diverges or is rotated downward. So if we measured from here to here and here to here, on a normal horse, those distances should be the same. And on this horse, this distance would be longer than this distance, so we know that this has moved downward. Um, These x-rays, most equine practitioners have digital x-ray equipment now so that we can get these right in the farm, on the farm immediately. So it's nice to schedule visits with your farrier and your veterinarian at the same time so that we can get these x-rays with your farrier standing there, so that we can give them guidance immediately as far as how to trim this horse. Because without an x-ray, your farrier doesn't know where this coffin bone is necessarily. There's some things they can look for. So this foot would be flatter on the bottom, so it would have lost some of its concavity. But other than that, there's not a lot of indication that they would know that this is rotated downward. This is an image of what we call a venogram. So this horse actually had an injury in this leg. The opposite leg was normal, but this horse had been hung up in a fence and lost blood supply and foundered in this one foot. But what we did here is we put a tourniquet above his fetlock and then put a needle into his vein and injected radio opaque dye into his vein that then filled the vasculature to the foot so that we could see the venous net that should be surrounding his coffin bone. So this gives us an indication of what the blood supply to the laminae and the coffin bone are in this horse. And this is not normal. So we have cutoff of the blood supply at the whole front of this coffin bone. There should be a net. So like this net back here, all this fine detail is blood vessels. That should encompass this whole coffin bone, should surround this whole thing, and it doesn't. So we knew this horse's coffin bone was in trouble. At the time that we took this, we can see that we've got maybe a couple millimeters of sole depth. This foot was bulging and oozing. We were deeply concerned that she was going to come through the bottom of the foot. And this horse did eventually peel off the bottom of its sole. We were able to save this hoof capsule, but at the time that we did this venogram, we were having conversations with the owner saying that we might lose the hoof capsule. And if we did, that was going to be the end of this horse. We did not lose the hoof capsule. We did have a surgeon come and do a deep digital flexor tendon cutting to try and stop this rotation. And then we managed the wound that developed at the bottom of the coffin, bottom of the sole for several months, and we were able to stabilize this, and the owner got another couple of years out of this horse before we eventually lost him due to this foot. But venograms are very helpful to tell us what the blood supply is. So if we had had cutoff at the coronet band, we probably would have stopped treatment at that time. But because we had some, and we actually did 3 venograms on this horse over the course of about 3 or 4 weeks, and they gradually got better as time went by. Laminitis is a big topic, and I could talk for 2 hours on it, but that's beyond the scope of this lecture. So lameness concerns. Old horses have been around a long time. They worked hard their whole life. They're going to have arthritis. I'm 54. I could give you a laundry list of joints that hurt. It's due to a lifetime of wear and tear. It's mostly due to degenerative conditions. HAHS and stifles and fetlock joints are pretty common areas. Laminitis comes into play, and then tendon and ligament damage and breakdown occur as well. If you have an older horse that just shows up out of the blue with a tendon or ligament injury, those may be related to Cushing's disease. So we're starting to test those horses for Cushing's as well as managing the tendon injury. And these are horses that are not necessarily performing anymore, so there's not a good explanation for why they would have injured that tendon. Those horses are getting tested for Cushing's. So some arthritis and chronic pain management tools would include considering joint injections if it's appropriate. And what I mean by if appropriate, if we have multiple joints on multiple limbs that are arthritic, I would question that joint injections are maybe not appropriate any longer. They may have been when you had, just their HAHS that were involved in the arthritis, or maybe just a knee that was arthritic. But if both HAHS, both stifles, a couple of fetlocks are all involved, that's a lot of joint injections in a horse that is maybe prone to infections. I'd start to worry about getting a joint infection from that many joint injections. So there are other ways that we could go to try and manage that pain. That might be systemic Legend, either IV or Adequan IM, some nonsteroidals on a daily basis or a limited basis when they're having a particularly bad day. Maybe that's a half a gram of bute once a day, which a number of horses can tolerate quite well, or a small amount of Equiox, maybe a half a tab of Equiox. Here, I shouldn't say here or there, because Equiox has a loading dose. So if you do 1 tab of Equiox here and there, you're probably doing nothing for that horse. You'd be better off using bute. Equiox works better if you start it and use it in a course. There are a number of horses now that are on Equiox all the time, which is not necessarily the best for them either. I would say if you're using Equiox on a daily basis, try to use the lowest dose possible, so not necessarily a full tablet, just to prolong the amount of time that you can keep them on that without doing gut or kidney damage with that drug. Increasing their fatty acid or omega-3 would be a naturally occurring anti-inflammatory. Consider using some nutraceuticals. Potentially, there's a lot on the market. Go for the ones that have some scientific data behind them. Shockwave treatments or physical therapy, conditioning, keeping these guys moving. So having turnout be multiple hours a day to just keep them moving. Spinal manipulation or chiropractic care, acupuncture and massage, heat therapy to try and keep things moving are all beneficial therapies for these older gentlemen and ladies. Okay, some tumors. 1 to 3% of the general horse population have neoplasia, but 27% in geriatric horses. So tumors are not, we don't deal with them as often as the small animal realm does, but we do see them in horses. Most common ones beyond pituitary adenomas and lipomas are squamous cell carcinomas, especially around the eyes and external genitalia. So pink-skinned horses with white around their eyes, or pink skin on their sheath and prepuce. Melanomas, 80% of geriatric horses will have melanomas such as this. And then lymphosarcoma are the 3 big ones. Treatment options are available for some of these, not all of them. Squamous cell carcinomas, if we catch them early, we can treat those tumors before needing to maybe remove the eye. We maybe can remove the tumor or do cryotherapy on the tumor, do some cryo on the prepuce or sheath before needing to do a bigger resection. Melanomas, there's some treatments that can be done to try and slow them down. Frequently, the gray horse will pass due to a different cause that's unrelated to their melanomas, but there are some melanomas that do result in the death of the horse. Lymphosarcomas are a bit more life-threatening than these other two types, and can be more difficult to manage. Respiratory, the most common cause in an older horse is HAHS, which is a non-infectious lower airway disease. It's managed medically with corticosteroids, which can become a little problematic if your horse has Cushing's disease as well. Corticosteroids have gotten a bad rap as far as causing laminitis, and we do use them with caution in horses that have a history of laminitis. But if your horse has HAHS as well, there's really not a better drug out there to manage a bad case of HAHS than steroids. So we may use them anyway, but just use them cautiously. And we may use an inhaled version so that we can use less. This is an image of an Equihaler that's come on the market in the last few years that delivers an inhaled steroid. Inhaled or systemic bronchodilators help with this as well. So ventopulmin is a systemic steroid, a systemic bronchodilator. Antihistamines they're frequently used, but they have low efficacy in horses. So these might be used at the early stages of HAHS, but as your horse progresses, we're probably going to be reaching for one of these other two drugs and leaving the antihistamines behind. And then there's environmental management that needs to happen. Dust and allergen control. So we may have you stop bedding them on straw, put them on shavings or newspaper, and then turn them out as much as possible. We may test them to determine what they're allergic to and try and remove that from their environment. Certainly if they're being fed hay, we're going to look at that hay pretty closely to determine if it's dusty or full of mold. If they're on round bales, we're going to caution you to get them off of round bales because round bales typically are a cause of dust and mold that will irritate a horse with HAHS. We may have you take them off hay altogether or soak the hay. And if we have you take them off the hay altogether, they would have to go on to a hay substitute such as hay cubes or pellets, or a complete pelleted diet to replace that hay. Cardiac disease in horses, the most common one is a degenerative valve disease. They'll have an acquired murmur. Frequently it is mitral valve insufficiency. The valve just becomes fibrotic and less flexible. So over time, if we're doing a physical on your horse every year, we may not hear a murmur for many years. And then as they get older, we start talking to you about hearing a murmur. Most of the time, those are incidental findings that have no effect on your performance of your horse, but they can, as that valve becomes less effective, it can lead to congestive heart failure over time. If your horse is fully retired and no one is riding it, we may not have you do anything to follow up on that other than us listen to it and monitor it over time. But if that horse is in a lesson program or your grandkids are riding it or you're still trail riding this horse, someone's still sitting on that horse, we may recommend, or we very likely will recommend, that you have an echocardiograph done to determine whether or not that murmur is related to cardiac changes that might result in the acute collapse of your horse, which would make it unsafe for you to ride. Most of the time they're incidental, but occasionally they come back with a condition that would make them unsafe and would need to put your horse into full retirement from work. And then in some stallions, there's a aortocardiac fistula that carries a pretty poor prognosis, especially if they're still being used for breeding, because that can rupture unexpectedly. Ophthalmic conditions, the most common one is cardiac or cataract formation. And this, you'll notice that their eye just slowly starts to have a cloudy appearance. Once they've progressed to this level of cataract, and this horse actually looks like it has uveitis, so I think this cataract was related to some uveitic changes based on how dark this pupil is. This horse is blind in this eye because of this cataract and its uveitis changes. This horse probably can still see some shapes and maybe bright lights, but it probably has some vision loss as well. It's pretty slowly progressive vision impairment. So most horses adapt, and owners may not even notice that there's an issue unless the horse is bumping into things as they come from a bright environment into a darkened barn. But as long as you keep your environment static, you're not putting obstacles in the pasture or in the barn aisle, a lot of horses will not let on that they can't really see. We've noticed more and more cataracts with the advent of really good headlamps that we're using to float teeth with, because when we look up at their face, you can see them with your headlamp without even using an ophthalmoscope. And then recurrent uveitis or moon blindness. This horse has a pretty inflamed eye. This is a puddle of pus in the bottom of that eye in the anterior chamber that is related to inflammation in the front portion of the eye. And then, like I mentioned, this eye looks like it has progressed from this to this over time with recurrent episodes. So we're getting towards the end. I know we're getting into our second, we're at 2 hours. So knowing when it's time, when is it time to start considering putting them down? Your horse will tell you when it's time, or their medical conditions will change and we'll need to make this decision based on humane concerns. So this horse looks pretty happy and healthy. He's still pretty bright. Yes, he looks like he has Cushing's, but he's pretty bright. This guy, he's eating. He's pretty thin. If this was the spring of the year, I'd probably, counsel the owner to let him have the summer, but maybe we revisit this topic in the fall before putting him through another winter for concerns about his body condition. If this was the fall, we get called every day this time of year to put horses that look like this down so that they don't, because of concerns about their body condition leading into winter. This horse is laminitic. If this was related to Cushing's and they had a body condition score like this, or these feet were rotated pretty severely, and we had little hope of turning this around, I would be potentially talking to this owner about putting this horse down for humane reasons. But if this was the first episode of laminitis and there was very little rotation and this was just the first day, we may have a pretty good chance of getting this horse back to rideable comfort. It would just depend on what's going on in these feet and how well they're responding to treatment. So can the painful condition be managed? And how likely is recovery? How emotionally attached are you to the horse? And do you have the economics to afford to treat or manage their current conditions? These are all questions that you need to answer or discuss with your veterinarian when you're trying to reach this decision. And then it's nice to be able to make these decisions ahead of time so that when you're faced with that decision, if it's in an emergency, you can do it in a smoother fashion. Talk with your veterinarian. We deal with this on a regular basis, so we can help you make this difficult transition. We can talk you through the process of euthanasia. There's several methods available. Our practice uses 3 different methods of euthanasia based on the owner's wishes, as well as what's going to happen with their remains afterwards. The 3 methods that we use are chemical euthanasia with pentobarbital, which has been the norm for many years. We also do lidocaine intrathecally following general anesthesia, which is a very smooth process as well. And then we also have gunshot available as well, which is considered a humane and safe way of euthanizing a horse as well. So care of the remains would be your personal choice and dictated again by where the horse is located and what's available. So it might be a rendering company that would come and pick them up, burial on your property if that's allowed, cremation if you want the remains back, and then composting if it can be done responsibly. Are there any questions?
We do have a few.
Okay.
And did you want to talk about fecal water syndrome before we got into questions specifically?
I can, sure. Yep.
Yeah, just real quickly, because I do know, I personally have known a couple horses that struggled with that. So I think, being that rescues tend to get a lot of senior horses. So I think that's something that probably is fairly common.
Yep. So fecal water syndrome. It's a term that describes an older horse. It's typically an older horse that has basically what it sounds like. So they pass a lot of extra fluid, fecal fluid around formed or semi-formed manure. And it can be, they can have periods of diarrhea, or they may have periods of normal manure, but then they also will pass a bunch of loose water, basically. And it runs down the back of their hind legs, and it gets in their tail, and it's just a mess. Causes a lot of phone calls, and it also causes a lot of concern in the wintertime in cold climates because it freezes in their tail and it freezes down the back of their legs. Treating it can be frustrating. It can be related to their diet. So if they're on an alfalfa diet or a really green hay, we might recommend that you take them off of that if you can. Oftentimes they're on that diet because they may have been thin and they're gaining weight on it, but that's a laxative diet, so trying to eliminate that from their diet may improve things, and switching them over to dry grass hay may help. It may not, but it might help. We'd check their deworming status. Sometimes it's related to encysted small strongyles, so treating them with Quest, which is moxidectin, with or without praziquantel in it, praziquantel in the fall to get tapeworms. Will treat, moxidectin will treat encysted small strongyles. Ivermectin will not, but moxidectin will. We used to recommend double dose Strongid for double dose Panacure as a Panacure Power Pack to treat encysted small strongyles. As small strongyles have become more and more resistant to Panacure, that's less effective. So I've gone more to Quest instead. You do have to be careful with Quest in miniature horses, as well as small horses. It is more dose dependent. It does not have the margin of safety that all the other dewormers have. So be careful about overdosing them with it. And also if you're dosing a horse from a rescue, if it's a severely emaciated horse or a really thin, compromised horse, I would probably not use Quest first. I'd deworm them with something else and get their parasite issues under control with a different drug before I'd go to Quest, just because it can cause some pretty significant side effects in those horses. Other things that we would try, Might be a course of steroids if they have intestinal inflammation that's related to it. There might be some blood work that's done to try and rule out an inflammatory bowel situation. There's a workup that goes along with fecal water syndrome in the hopes that we'll find an effective treatment plan for your horse. But there's also a group of them that we are unable to effectively impact. So some of it is just management. So keeping their tail out of the way, washing them, putting diaper rash ointment down the back of their legs, and just periodically cleaning them up so that they don't get fecal water scald down the back of their legs. Does that help?
Oh,
Jenny?
I'm sure it absolutely does.
Yeah.
Yep, I always
It's a
mute myself.
frustrating condition.
So wonderful. And then a couple of our guests did have specific questions. Lisa is with us, and she is the equine director for a small rescue in Virginia. Welcome, Lisa. And she has a nutrition question for retired brood mares. She frequently gets senior brood mares with varying degrees of visible hips and prominent hip bones after a lifetime of being bred. As they begin to put on weight, they often get big bellies, but stay ribby and a little bony in the hips. They obviously don't have great top lines either. For example, a few months ago, she got a 24-year-old Trakehner brood mare, 16 hands and just over 1,400 pounds, but had that ribby, bony hip appearance and a body condition score of 3.5. She's refused to eat soaked alfalfa, so she's been getting 2 pounds of soaked beet pulp and 1 pound of senior feed twice a day. She also has free choice hay and eats that well. Her belly is now swinging side to side, but can still see ribs through her winter coat. With colder temps coming, do we keep feeding to the ribbiness, or is it just a result of being a senior brood mare, much as some of human ladies
Yes. Human ladies have the belly that will not go away.
Right. Okay, thank you. That's where I was going.
So definitely these brood mares that are multiparous, so they've had many foals, ribs are sprung. They're not going to go back to that sleek, youthful appearance. But you should still be able to cover their ribs and hips. Given the diet that she describes, sounds like she refuses alfalfa pellets. Is that what she said?
Let me go back and double check. Soaked alfalfa. So I don't know if that's long stem or pellets or cubes or
soaked alfalfa. So the first thing I would do is, if she's capable of eating hay without dropping wads of it, so if her teeth are in good enough shape to eat hay effectively, I would get her on a good quality grass alfalfa hay, free choice. And then add some fat to her diet. So rice bran, a pound and a half of rice bran twice a day. And then increase her senior. She's on a pound, it sounded like, twice a day. I'd increase that. There's plenty of room to increase that. You could increase that to 5 pounds twice a day easily if changing the quality of the hay didn't make an impact, and adding the rice bran didn't help. But I think she just needs more calories for starters to try and cover those areas up. But she should be able to cover them up. There's nothing about her being a brood mare for a long period of time that should prevent her from covering those up. Yes, her belly is bigger because it's been stretched out, but she should still be able to cover up her ribs and hips. with adequate weight. So I would increase the quality of the hay that she's getting, so she's getting more calories out of that hay if she can chew it effectively. If she's dropping wads of hay, then obviously get her teeth looked at, see if we can fix that problem. If we can't, then go to the senior and increase the senior to that 1.5 to 2.5% of body weight calculation that we talked about on the nutrition slides.
Okay. And then sort of keeping on the nutrition theme, we have two other questions. One is, what are your thoughts on feeding Purina Senior or Purina Senior with Active Age? I don't know what that particular item is. And the second part of that is, what are nutraceuticals?
So nutraceuticals are nutritional supplements that are fed through. They are not FDA regulated, and they're not drugs. So they're like hoof supplements and joint supplements, and like Cosequin is a nutraceutical. They're all the myriad of supplements that horse owners can find on the internet or in the tack shop that are fed through. So top dressed on feed.
Okay.
The downside to them are they are not regulated very well, and it doesn't take very much to make a claim on the label. So those companies are not held to a high level of, there's no governing body that says you have to have this in your product in order to make this claim on the label.
Or you have to have so many independent studies proving what you're claiming. Okay.
Yeah. Yes. So there's a lot of money made by those companies selling products that are not all that effective. So I would talk to your veterinarian about a product before buying it, because the least expensive product is probably not the most effective.
Gotcha. Okay.
And if you're feeding multiple products, you may be, being redundant. Yeah, you might be redundant in your program. And there might be some, one product that we'd recommend that we've had good experiences with that would take the place of multiple products that you're already using. So
wonderful.
And then as far as the Purina question,
yes,
the senior landscape of nutritional products has gotten more crowded. As the senior population has grown, the feed companies have recognized that geriatric horses are not just, owners don't just want them to be able to survive into their geriatric years, they want them to be able to perform into their geriatric years. So now there's a group of feeds that are designed for geriatric horses that are still working. So there's senior active and senior performance versus just plain senior. So that just is an indication on the label that they have more nutrients. So it's usually more fat and maybe more protein in that product than in the same line of feeds, the senior alone versus the senior active. Does that make sense?
Mm-hmm. Absolutely.
So if you have a senior horse that's a hard keeper, you might go for senior active because it probably has more fat in it than just the plain senior.
Sounds good.
Yeah.
Do you have time for just a couple more questions?
Sure. Yep.
Wonderful. So we all struggle with blanket choices. So Kathy mentioned she has a 27-year-old mare who has a good winter coat and is outside 24/7 with a run-in shelter. How would you recommend we decide whether to blanket or not?
Okay. So she says she has a good winter coat, lives
Mhm.
outside 24/7 in a running shed. The next thing I would need to know is what her body condition score is. So if her body condition score is good, so she's a 5, 6, 7.
And our people who are sending questions through the chat, please feel free to unmute yourself and provide additional information to Dr. Nesson.
Okay. So if she's in good flesh, she may not need a blanket, depending on how cold it actually is, because it sounds like she has adequate hair and she's got a run-in shed. If she's able to eat hay, I would increase her hay access because they get a lot of heat generation from digesting fiber. So you might be able to just increase her fiber source and let her use that run-in shed in her hair coat.
Okay, and Kathy does say she's a 5.
She's a 5, so she's ideal but not overweight.
She might even be a 6, but my concern is that she's 27 years old, and what do I
What part
look?
of the country are you in?
We're outside of Chicago.
Okay, so it gets cold.
Yes.
So
It's really nasty out. Like she would be inside sometimes.
Okay.
It's really bad out, but I don't know whether like even right now to put just a sheet on her, lightweight blanket, or just
I
leave her
tend to
be.
not blanket more than I blanket. So
Okay.
my horses that live outside 24/7, my preference is to not blanket them, because blanketing is, if you blanket and you blanket inappropriately, then you've made things worse for the horse
Right.
because
Yeah.
you've laid their hair coat down and you've taken away their insulation layer.
Okay.
If you're using a blanket that's too heavy and they're sweating under it, now their skin is wet and they're probably colder than they might be if you had not blanketed them at all. If you use a blanket that's too light for the temperatures that they're in, you've done the same thing. You've laid down their insulation layer, but you haven't given them something to replace it with. So if you're going to blanket them, you need to be diligent about making sure that blanket is dry and making sure that it's rated for the weather that they're in. So if it's really cold, it's got to be rated for that weather.
Okay.
If it's wet out, it's got to be rainproof.
Right.
And if it gets warm, then you got to go take it off.
Yeah.
So it sounds like your mare is in a good situation to take care of all of that herself.
Yeah. I
On
think
the
so.
really bad days, you're going to bring her inside. So I probably
Okay.
would not blanket that mare at all.
Perfect.
Yep, unless I was turning her out for the day and then bringing her in at night. And I might turn her out. If you're still riding this horse, then I might turn her out with something on that's appropriate for that day so that she's not muddy when I want to bring her in and ride her that night.
Okay. And I was the same one that asked about the Purina Equine Senior,
Okay.
the active age.
Yep. So
And
going into the winter for a mare that's at a 5, that you're wanting to work, you might switch her to the senior active just because the calories they're going to burn over the winter are more than what they'll burn during the summertime. So you might
okay.
want to increase, just switch her over to that product to get a little more oomph out of the same volume of feed. And then, just so that she holds that 5 or maybe goes up just a little bit.
Okay.
And then maybe in the summertime when she's got access to pasture, you can go back to the regular senior again.
Perfect. That helped me tremendously. Thank you very, very much for your time.
You're welcome. Yep.
Wonderful. And I think we have, oh, there's Jen. I think she had a question that she's been very patiently waiting on, so we'll let her ask that.
Yeah, I have a question that I put in the chat. It kind of covers your whole presentation in a way. Try to make it short. Last spring, I adopted a senior pony who had a history of founder and laminitis and malnutrition, and she was actually seized by the sheriff when she was rescued in 2020, and a rescue group restored her to a more stable condition, but her hoof x-rays from 2020 showed rotated coffin bones. Her body condition is a 4, and I wasn't able to put more weight on her over the summer. She takes a maintenance level of Equiox. She gets regular chiropractic care. She does not have equine metabolic syndrome or PPID when checked recently. So I think I'm doing the right things with regard to her preventive care, her nutrition, her vaccinations, deworming, from what you said earlier. Mm-hmm. She has a good farrier who comes every 5 to 6 weeks, and now she has infected hooves even after dry weather, like thrush, bacteria, fungus, whatever, that's being treated with Save-A-Hoof and Sole Pack. Yeah. And she has dished out soles that maybe are from past abscesses, he said. She's not showing any signs of lameness, but she might be pretty stoic. And I walk her regularly. She's in her 20s somewhere. I walk her regularly and lunge her at a walk or trot for short periods of time, and she's not showing lameness. So I'm just trying to keep her moving. But given her health history, I just want to know is there something else I can or should be doing to keep her healthy, especially her hooves? And I'm concerned about that being her weak point. So yeah, I mean, everything else seems to be checking out fine, but I know she has this horrible health history. So
right. So I don't think you mentioned anything about her teeth.
Yeah, her teeth were checked, and the vet that checked them in the spring and the fall said she probably will need to have them floated in the spring, but they looked okay. They were able to do an exam without having to sedate her. I mean, not a full exam, but when they looked at them, they said she didn't need anything right away.
Okay. And you've had her for how long?
Since April.
Okay.
And the rescue group had her for about a year, where they were trying to get her back into better health.
Okay. And since April, you haven't seen her gain an appreciable amount of weight.
Yeah, everyone thought she had gained weight from looking at her. She looks better, but when the vet actually did the weight tape, she got the same thing she got last spring. Okay. I thought she would do it more consistently than I would, so I asked the same person to do it.
Okay.
So she looks better, but from measurement, she hasn't
on the numbers. Okay.
Yeah.
So the concerns that I would have would be the chronic foot problems and the fact that she hasn't gained much weight over the summertime. So the next question I'd have for you is, do you know what tests they did for PPID? Did they do a TRH stim, or did they do ACTH level, or what test did they do?
I don't know. I would have to look it up, so I can't tell you that off the top of my head, but I should check on that.
Yeah, so I would talk to your vet about that, because if they did an ACTH level baseline, she may still have Cushing's and they just missed it, because sometimes the baselines are normal, but the stim 10-minute post stim is positive, and that horse has Cushing's despite having a normal baseline. So that would be my first question for your vet on that front. And that might explain why you haven't been able to kick the hoof issues with the thrush, it sounds like you're dealing with, or maybe white line disease. So that would be one question. The next thing is, if they haven't, either the rescue or your veterinarian hasn't done a sedated oral exam, I would ask for one of those. Get a mouth speculum in there, get their hands in there so that they can tell if there are sharp points or ramps on the back of the last teeth that they can't reach with just pulling their tongue aside and looking, or if they have loose teeth that look normal, but once you get your hand on them, they're loose. and see if there's something more we can do in her mouth. And then if all of that checks out, then increase her feed. Yeah.
Okay. Thank you. Thank you very much.
You're
Thanks
welcome.
for your time. I learned a lot today.
Good. Glad it was helpful.
Oh, it was incredibly helpful. Thank you so much, Dr. Nesson.
Good.
Well, we have one more question for you. So every good podcast or series has that question that always gets asked of the presenter. So ours is, what was your favorite book as a child? Either one that got you interested in your passion for horses, or just the one that pops off the top of your head?
All of the James Herriot books were my favorite.
Excellent.
Yep. The James Herriot books and the Laura Ingalls Wilder books were my favorites. I have to laugh. I still read the James Herriot books periodically, and there are situations in my daily life as a veterinarian that just make me laugh when I remember the descriptions he had and how little it has changed over the years. Yes. Like the first time I met a cow with a prolapsed uterus, I had an image of what he was describing and the reality that was in front of me. Yeah.
Okay, so early training.
Yes. Yeah.
Wonderful. Well, we
Yes.
have up on the screen your contact information. So if anyone wants to reach out to you, they may email you at info@irongateequine.com.
Yep.
Wonderful.
Yep.
Or give a call, and you can, of course, follow them on their website as well as social media.
Yep.
And then next month, we are still figuring out our topic, because being the holidays and Christmas and winter, we know there's a lot going on. So we are still determining what we'll be talking about, or if we will maybe take the month off, but we want to keep our momentum going. So, and it sounds like, Dr. Nesson, you might be great to have back next year to talk about laminitis or nutrition or one of those topics. So we look forward to having you back in the future.
We'd be happy to do it again.
Thank you very much for your time.
You're welcome. You're welcome.
And I was just about to say, does anyone have any last questions? But
Just
I think
it was very informative.
Yeah, thank you.
Good.
Wonderful. All right. Thank you, everyone. We wish you a happy Thanksgiving, and we hopefully will see you in December. If not, definitely January.
Thank you.
Okay. You're welcome.
Thank you. Take care.
Bye. Bye.